Hi class, I'm Tiff. So for this project, I selected the home health scenario. It states that a social worker is part of a home health team that provides services to people with serious medical conditions. During the last visit, a client with an immune disorder who is receiving chemotherapy at home tells the social worker that another member of the home health team refuses to wear a mask during the home visits and asks the client not to report it or they, quote, would be fired. What would you do? So for me, I 100% would report the incident immediately. I would report it both to my own supervisor as a social worker as well as to the supervisor of the health aide who had violated the policy for the mask. I would ensure also that the client was assigned to a new health aide immediately, so that even while adjudication was taking place, there would be no conflict or undue hardship for the excuse me, for the client as they waited for resolution. I also feel like the healthcare worker has made several ethical violations here. First, they blurred the line between caregiver and client. So, in order for our clients to trust us as social workers or health aides or advocates, we need to keep our lines clear. Boundary setting is important, and when they went ahead and told the client that they would be fired if the client were to speak out about the situation, they placed an unfair burden on the client, and they made it the client's responsibility to caretake for the health aide's job. So that line should have never been blurred. They also will have betrayed the trust and the confidence of the health aide, and perhaps the entire social system. Because the patient is immunocompromised, the patient is already going through chemotherapy and immunocompromised and needs that mask for his own safety and protection. For someone to have willingly and knowingly violated that mask policy for whatever reason, whether it be political or personal or simply comfort level, you could undermine that patient's faith in the entire system. For someone with such knowledge and at the time such authority over their care to be so blatantly disregard safety measures could potentially undermine his faith in that aid, that facility, or even the entire system. And to have a patient or client who doesn't believe in a social welfare or medical system anymore creates a patient who won't ask for help. And those are people that end up, in pretty dire circumstances. Also, the health aide who refused to wear a mask will have placed that patient directly in harm's way. And as a caregiver, especially for someone who is so vulnerable, that kind of action just can't be taken lightly. It must be reported. Simply put, it's not personal. It's not political. It's about the health and well-being of the client. And for anyone to take an action that would directly disregard the health and well-being of their patient or client for their own comfort, whether it be emotional, political, physical, or otherwise, it must be reported. That is a person who, at the very minimum, should be retrained. In my current positions in my current organization, I'm a patient advocate at the Veterans Hospital, as well as a clinical intern at Leaves of Change Counseling, which is a sex therapy practice. So both of these organizations consider themselves to be high reliability organizations, and a part of the definition of high reliability organization is that you do leave room for error. So under the policies of these two particular organizations, the health aide who violated this policy would not be immediately fired. They would be formally reprimanded, and after a first offense would be retrained. The reprimand would stay in their file for approximately 3 years. And a second offense would be a second written reprimand, often with loss of pay, unpaid suspension, and a third offense would result in termination. Now, my primary job at the VA is a federal position, so it's a little bit more difficult to eliminate an employee than at a private organization. But through that three-step process, someone who will not adhere can absolutely be terminated. And if someone were to put a patient more directly in harm's way or more overtly, they could be terminated immediately. So I feel like the proper response is to report, retrain, and if they aren't reformed, to remove them. Thanks so much for listening to my perspective. Have a good one.